Hi, my name is Marie Reeves, and this is my capstone and 5-year plan presentation. I'll start by telling you a little bit about myself. My education consists of a Bachelor of Arts in Psychology, an associate's degree in nursing, which I received in August 2011, and I'm completing my Bachelor of Science in Nursing this May 2018. My experience consists of 1 year of floor nursing at Las Palmas Medical Center on a renal floor from November 2011 to November 2012. I then transitioned to school nursing with the Socorro School District, and I worked there from January 2013 to April 2014, where I then received a position with the U.S. Army Medical William Beaumont Soldier Care Center. And I worked there from April 2014 to June 2014. And then I transitioned with my husband to Fort Jackson, where I got a job with the Fort Jackson Family Health Clinic. And I began working there August 2014 to the present time. I do have certifications with my BLS and my ACLS, and I'm also a member of Sigma Theta Tau. In this presentation, I will identify all 7 of the nursing student outcomes listed in the RN to BSN student handbook and how each of those outcomes have been met through this program. The BNS organizing framework constructs consist of humanity and society, lifespan health continuum, evidence-based practice and clinical reasoning, patient-client-centered care, and professional roles. So the first outcome, humanity and society, consists of practicing safe and effective, holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I believe that this outcome was fulfilled through Nursing Course 4321 with the philosophy paper assignment. What did I learn in this assignment? I learned to apply nursing theory, mainly the Watson caring theory, to my practice so that my practice was more intentional. I also believe that this outcome was met in Nursing Course 4540 with a Special at-Risk Populations and Settings project. What did I learn from this project? It allowed me to practice critical thinking skills, and I learned how to provide safe care to different populations than I was used to dealing with, such as the homeless community, or the adolescent community. I also learned some about situations and circumstances that can cause individuals to be at risk. I believe that this objective was met with a 90%. Lifespan Health Continuum student outcome number 2 consists of supporting patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I believe that this outcome was met in Nursing Course 4620 with a community-based resource learning activity. What did I learn? I learned how to find and access resources in the community, and I also was inspired to think of new ways to teach patients and promote wellness. This outcome was also met in Nursing Course 4620 with the practicum reflections. What did I learn? I learned how to involve the patient actively in their care, and that patients don't all learn the same. Teaching has to be adjusted for each patient. Lifespan Health Continuum student outcome 3 evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. I believe this outcome was met in Nursing 4580 with a discussion question, the Lewis Blackman story. What did I learn from this assignment? I learned the importance of listening to families and patients and actively involving them in their care. And I also learned the importance of making sure that the patient is receiving the appropriate age-appropriate treatments, and that that the care that they're receiving is age appropriate for the health and the age of the patient. Evidence-based practice and clinical reasoning, student outcome number 4. Synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I believe this outcome was met in Nursing Course 4390 with a critique of quantitative research paper assignment. What did I learn? I learned the importance of evaluating studies, that not all studies are created equal. And I also learned that there were different categories and different types of researches, and some are more appropriate for different types of situations and circumstances. I believe that objective was met with a 90%. Patient-client-centered care, student outcome number 5. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. I believe that this outcome was met in Nursing Course 4316 with a holistic theory-based nursing process assignment. What did I learn? I learned how to incorporate a nursing theory into care planning and how to more effectively collaborate with the patient to ensure that they are actively participating in that plan of care. I also believe that this outcome was met in Nursing Course 4620 with the practicum assignments number 1 through 4. What did I learn? I learned it's very important to have the patient involved and that they buy into their responsibility to be a part of their health, and they have a responsibility to be actively involved in it. And also the importance of interdisciplinary resources such as nutrition or other specialties such as gastroenterology in achieving and maintaining health for the patient. Professional roles, student outcome number 6. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. I believe this outcome was met in Nursing Course 4550 with a clinical application assignment addressing a problem. What did I learn? I learned that I need to be actively looking for ways to address issues that I find in my own facility. And I learned that it's the role of all nurses to advocate for change when they see a problem. Don't pass the buck. Professional roles, student outcome number 7, demonstrates professional integrity, effective communication, active inquiry, and service to the community. I believe this nursing outcome was met in Nursing Course 4540 with the Care of Communities, Civic Pride, and Diversity Project. What did I learn? I learned that I can contribute to my local community and make a difference with just a little bit of time. Anyone can volunteer, and there's so many places that need assistance. And caring means giving of your time. Volunteering. I believe that objective was met at 95%. In conclusion, my 5-year plan includes the following. Within the next 5 years, I plan to complete an AAANC ambulatory certification, join the American Academy of Ambulatory Nursing Care Association. I would like to transition into a case management position and complete the ANA case management certification. Finally, I believe that the RN to BSN baccalaureate program has exposed me to some amazing nursing theories such as the Watson Caring theory, which I have used to focus my nursing practice and incorporate into my practice daily. It has sharpened my clinical reasoning and research skills, making me a more rounded nurse. This program has enlightened me on the importance of being part of a nursing association so that I can affect nursing policy. It has honed my leadership skills so that I can guide those who work under me effectively, and it has inspired me to make sure that I do a thorough job of orienting the nurses that come through our clinic. Thank you very much.